Health Workforce for the Future is the local HPOG project in King County, Washington, and the general goals of our project are to help people prepare for and become employed in healthcare occupations.
Help individuals advance in their career and not just stay at an entry-level position, but ultimately reach a self-sufficiency for themselves and their family that can help them long-term.
Healthcare is an inherently complicated sector to work in, and so sometimes the breadth of players in healthcare in King County can really add to that complexity. When we built the Health Workforce for the Future project model, the Navigator sat in the middle of everything, really. The Navigator is sort of the critical element that drives almost everything else in our project.
Navigation to me is the ability to provide unbiased advice to each and every client that we meet with. Individual planning and support so that they can be successful along the way and avoid barriers as much as possible.
Navigators are important in people's lives because you're basically our advocate, for those in need, and without that, I don't know how much of a progress, even without Jesse, I would have made on my own.
I've been working with Brescia for about 5 years now. Brescia came into our program initially as a referral out of the TANF office, interested in a nursing program.
At first, walking into the office, I was nervous because there's a certain stigma when it comes to asking for help. But once I met Jesse, it just felt like another family, really. They're just here to help you, and you don't feel guilty.
Having that discussion with the individual and seeing where they're at. Sometimes they're so focused on the financial barriers that they have in their life that they don't really see the other barriers that could come into play.
Once I started the process of my CNA license, I was helped with being provided a bus card where they would load money so that I can have transportation to get to where I needed to be. They assisted me with childcare so that while I am doing my programs, my daughter was being watched.
The need is there, and it's never too late to start. By them having success, maybe it impacts their children down the road. It breaks a cycle of poverty for their family.
There were certain times where someone else within the office had more information about the topic, and they would just come in and kind of tag along with the meeting and provide more guidance.
We've evolved to this team-based approach that I think allows us to fully capitalize on the strengths of our Navigator team and allows us to build a team that is diverse in a lot of different ways that reflect the population that we're working with. The fact that Navigators do work in such an individualized and customized way with customers, and that, partly through the team meetings and just through the relationships that they have with one another, the fact that they are able to be a feedback loop to us around what's really happening, what's really working, what works in certain situations and doesn't work with others, I think has really improved the depth of understanding that we have around what does it really take. There's a balance, I think, between making sure that folks are successful on the job and that they are gaining some comfort and getting a solid foundation, but continuing to work with them to be thinking about what's next.
Jesse helped me start with my CNA license, and he's still helping me to pursue nursing. To know that someone's on your team, it's very, very reassuring.
I hope she can truly be proud of what she's accomplished to this point and know that there's more to come.
It's wonderful.